Hello everyone, I am Dr. Prathyusha Reddy, working as a consultant in Birthright by Rainbow Hospital, Banjara Hills. Today, I would like to enlighten you people about genital herpes. Genital herpes is basically a sexually transmitted infection. It is mainly caused by herpes simplex virus. This virus is mainly responsible for causing two types of infections. One is the infection which can occur at the genital area, which we commonly know as genital herpes, and this virus can also cause lesions around the mouth and other skin involvement can be there. So usually genital herpes, the symptoms show up after 2 to 12 days of exposure to the virus. Most of the symptoms that what we see in this genital herpes, it starts first as a small blister-like lesions, which they actually spread in a particular area of the nerve, and later on these blisters, they burst open and release some discharge leading to ulcers and heal up gradually by scab formation. So the symptoms when these ulcers appear, they are varied or like mild flu-like symptoms. So some of them may have symptoms like fever, myalgia, and there will be excruciating pain in the areas where these ulcers are seen. If at all they are in the genital area, they have a difficulty in urination, and some of them have the vaginal discharge, which most of the female patients approach a doctor. So most of these lesions are self-limiting and they reduce by about 7 to 10 days. So there is no vaccination to prevent this infection, but by using the antiviral medications, we can reduce the symptoms or we can prevent the recurrences. Basically, these are caused as it is a sexually transmitted infection, having multiple sexual partners, or if at all when the partner is infected with this genital virus and when they have sexual activity during this period, then the possibility of infection is high. So whenever these patients come to us, we counsel them that to avoid intercourse until their lesions are completely healed, better to use a barrier or a condom to prevent this infection, avoid multiple sexual partners, better to use the medications to prevent the recurrences in future, and antiviral medications, they also reduce the symptoms. So these diagnosis by, we can locally examine a patient who comes to us whenever these they come with this severe pain. So when we see these lesions, we can think about the possibility of herpes. Basically, there will be a severe excruciating pain, and there will be, these lesions will usually be seen wherever there is one nerve involvement. And later on, we can see ulcers with scab formation. So we can think about this infection, and these usually they resolve by about 7 to 10 days. There is a possibility that these recurrences can happen in future. So whenever we find these symptoms, we should ask them to use antiviral medications. They are given for a duration of 5 to 7 days. Now, what extra care we have to take in case if at all this genital herpes happens in ladies when they are pregnant? Usually there is no particular treatment or there is no way we can prevent or we can diagnose whether that this infection can happen. So if at all a woman comes to us with these symptoms in their first and second trimester, there is no specific treatment extra that we can give. So we have to start them on antiviral medications which are safe and can be taken during pregnancy. But if at all this infection happens in the late third trimester or when they are due to deliver, then in that case we have to be a little careful because the possibility of this infection happening to the newborn can be there. So we should alert the neonatologist that a mother is suffering from this, so that whatever the necessary investigations to be done to the newborn and whatever treatment can be offered to the baby.